Hi, welcome to Two Things. My name is Britton. I'm the Chief Medical Officer at Mass General Hospital, and today we're lucky to have Paul Biddinger, who's not only an emergency medicine physician, but also in charge of disaster response across all of Partners. And today we're going to talk about IV fluid shortage and what's been going on at Mass General. So Paul, how did we get here? How did this all start?
So, although we've had IV fluid shortages actually in the country since 2014, really the big problem is Hurricane Maria that hit Puerto Rico in September of this year. 40% of the manufacturing capability for IV fluids for the whole country was in Puerto Rico, and that's caused a ripple effect that's affected all of us, definitely at Mass General and at Partners.
Okay, and so how are we dealing with that at Mass General Hospital?
So almost as soon as we learned that the IV fluid manufacturing had been affected, we brought a team together with patient care services, nursing, pharmacy leadership, and they've been doing an amazing job of trying to find solutions. But the situation's gotten worse, and as of late November, we activated the hospital's emergency operations plan, the incident command system, to make sure every part of the hospital has been involved in the response. Our two big categories of solutions are conservation, so we try not to use IV fluids if we don't have to, if clinically they're not needed, and adaptation, so use equivalent strategies as long as they are clinically equivalent, that we're not changing the quality of care.
When do we expect things to get better?
Unfortunately, because the storm was so severe, we've been told that it could be another 2 or 3 months at least. So realistically, March, April is the soonest we think we'll be out of the situation.
And are we at risk of running out of fluid?
We are at risk, I hate to say that, but because this is a day-to-day solution, if we do not take the most aggressive conservation and adaptation measures, there's a chance that we can't sustain our same level of clinical operations, which is why we've been trying to message this so strongly.
Now, I know many people have been working on this and trying very hard, but has any of this impacted patient care so far?
So we really don't think so from a quality or safety standpoint. It's really important for everybody to understand that the solutions we are choosing are equivalent. So if patients need IV fluids, they should get IV fluids. If patients need a certain therapy, they should get that therapy. But we're asking everybody to work within their physician, provider, nurse, pharmacist team to make sure that if there's an appropriate conservation or adaptation strategy available, that they use that.
So would it be fair to say that we should be mindful of how we use IV fluids, but everybody's getting what they need right now?
That's very fair. I'd like to say extremely mindful.
Great. So thank you. And that's Two Things with Paul Biddinger and O'Neill Britton.